Welcome to Hand Therapy. I'm Tom.
And I'm Dom.
We're going to be talking about tennis elbow or
Lateral epicondylitis.
We get to see a lot of this in the clinic.
It's basically pain here in your elbow on the outside. That's your lateral.
Yep,
And sometimes this is your epicondyle.
Down into the wrists, it hurts too. So they're both it's pretty common. It doesn't mean that it doesn't hurt a lot.
And it also doesn't mean that you play tennis. So.
No, there's hardly anybody we actually see that plays tennis. We saw someone who was a tennis player and was like, whoa. That was pretty neat. So we want to talk to you about how to take care of this. It's your body's cry for help.
So one of the most important things, you can get all the therapy that you want, but if you don't avoid the activities that are causing the pain, which is this repetitive pain or repetitive activity, it's not going to get better. You have to give it time to heal, and it might be a while. So just being real, it takes a while to heal from this. And activity avoidance is key.
Yes, people will not get better if they don't avoid those activities for a little bit of time. What's happening there is that the muscles are literally pulling at this stuff around the bone, and the bone itself is not the injured area. The little nerves in there are telling you that your muscles are trying to pull away and do little micro tearing from that bony landmark. So, very important that you start doing the exercises and start avoiding what is causing those things to happen for you.
Listen to your pain and let it guide you away from those activities.
What'd you say though? Say it, because that was good.
Think of your pain like a smoke detector, and when the alarm of a smoke detector goes off, you wouldn't just go, oh, it's fine, I can just work through it, it'll be fine. But you do that so often with pain, or we all do. And so you have to make sure that you take the time to see what's the problem or figure out what's the problem, avoid that activity, let it clear out, and then you can go on with your smoke-free life.
Oh, speaking of that, if you're smoking, it's going to decrease your chance of healing like 80%.
For
everything. I can't remember.
Yeah,
for like healing, it's just horrible for your body. You should look up research and stop smoking if that's happening. So one of the greatest things that you can do for yourself is to not twist. Like this is like my people who use ratchets and like screwdrivers. They'll get it right up here. Typing with your wrist and extension, even like this on your lap, like lots of college students. Or, dropping them down too low.
Yeah, try to have neutral wrists when you're typing, and try not to get those fingers up like this. I mean, it's like everyone's at the ready to get into those keys. Just notice how your hands are positioned on your keyboard.
So another one is unscrewing tight jar lids. Once this happens, you want to stop.
And a big one is, it's a weird thing that we all do, is this crane grasp. When you go to grab something, especially out of the fridge, and you're extending your arm so that it's at full length elbow, and then you're grabbing something from the top, like a heavy jar or milk,
juice.
Milk crate or something, milk carton.
Child's head.
But it's together. This extension and this grip really wreaks havoc on not only your elbow but your forearm muscles, and can be bad for your wrist too. So avoid that activity. You want to think of yourself as a T-Rex. If you're suffering from this condition,
without doing that.
Yeah, don't be like this, but a T-Rex. So you have your little arms, short arms. Keep your elbows to your sides, and I also say be Fonzie. So keep your thumbs up or T-Rex.
Plus, you're super cool this way.
It's so cool.
It's way better.
Fonzie T-Rex. So
that's how you're to carry groceries. That's another one. Not to grab them off of the floor. Here, I'll go way back here. Crane grasp. Grab them off the floor. That hurts, that elbow.
So avoid that. And then when you're lifting things from a shelf, pull it close to you lift it with 2 hands, Fonzie T-Rex arms.
Okay.
That's the coolest.
Yep, and also using bigger muscles or your opposing arm, the one that's not injured, to do some of that lifting. It's going to really save you. So going through other activities as well.
So another big one is when you grab laundry, heavy wet laundry out of the washing machine. Guess what? Crane grabs. It's usually one arm. It's probably your dominant hand, and you're lifting a lot of weight, and you'll think, ow, it hurts, but I just have to finish this load. And the more I can grab at one time, because all the jeans and the towels and everything are wrapped in together, the better. No, reach in with both hands. Pull some of it closer to you. Pull it out, put it in, not this.
Yeah, try to be your advocate for your body with this. Don't speed through anything. It's your body that's injured. You have to heal it. So next one is carrying a shopping basket. I already went through that a little bit. Briefcase or purse or suitcase. That's all that extended reach. Grab it and like get down, pick it up, and then have T-Rex Fonzie arms and carry it that way.
Another thing when you're using tools, so we understand there's work to be done. You've got to, some people are using, if you're gardening or if you're using tools for work, try to have a bigger grasp for that tool. So if you can get some foam or some tape to wrap around a handle, that's going to help. Even using anti-vibration gloves if you use tools that have any sort of vibration. Even sometimes driving, when you're driving a truck or something that has a little bit of
I just thought of something too with driving. That was a good, yeah.
But if you're driving a truck that has a lot of vibration, you can really put a lot of strain on you'll be gripping it so tight that you'll put a lot of strain on those forearms.
Also, how often have you seen this? When people are driving, this extended arm and that rotation is one of the worst things that you can do for your elbow, especially males. I'm just going to tell you, I don't know very many females who drive like this, but I've seen a lot of guys do it. They always put their seats way far back, lift your seat up, it's better for your posture, and grip the steering wheel lower so you can prevent some of that injury.
And I know that this is a challenge, although this is a very safe driving habit, but if you can drive with more neutral Fonzie arms closer to the steering wheel, that is going to be better for your elbows.
Scraping a windshield off is really horrible as well because you're using that same motion. Tennis, of course, you have to take a break.
So there are rackets now that you can get, anti-vibration rackets. There's rackets for tennis elbow that offer a little bit wider grip. And that have, I don't know a lot about tennis. My husband plays tennis, so a little bit, but there's rackets that you can get that'll just alleviate some of those symptoms.
Yeah, and also kayaking and racquetball. So kayaking, if you think about that, you're doing the same motion over and over. You have to take a little bit of a break from the hobby that you love in order to maintain and preserve your arm.
And I know it's difficult. Not everybody can take a bunch of time off work to heal. But if that is the case, and you can't modify your activities at work, you have to take set work breaks. So 15 minutes, take your 15-minute, don't work through your break. Try to vary your activities through the day so you don't just do a bunch of that repetitive stuff and then work on something else entirely. Try to vary it so that you can do that, and then a little bit of this other. I mean, I know it's not always totally conducive to whatever your job is, but if you can make those changes, please do.
So you want to teach them the self-massage, and I'm gonna film you?
Well, let's do that on the next video.
Oh, well, okay.
So we'll have a couple other videos that show you some stretches, some massage, and some exercises for tennis elbow.
Another big thing I just want to say before is that most people say it's not tendinitis, it's actually tendinosis. Usually it's an overuse syndrome, which means that your muscles themselves are not getting a lot of blood to them. Tendinitis has a lot of swelling, and you can have lateral epicondylitis from trauma or some sort of traumatic event like overshooting. I've had that happen a few times when they're boxing and they overshoot, and then they actually have that trauma to the elbow, and that's lateral epicondylitis. So use some heat is what I was trying to get at, not ice. Heat usually works.
Yeah, if you do the over punch or overthrow,
Ice.
then ice.
Okay, great.
All right. Thank you for
Bye.
watching, and please watch our other videos that'll help you progress through the stages of lateral epicondylitis. Osis.